as you may know, the West African Health Organization, or WAHO, which is the branch of the regional body ECOWAS that deals with health issues, is this week marking 31 years since it was created. The aim was to ensure the highest possible health standards for the people of West Africa and to protect them against diseases. Well, since that time, 31 years ago, there have been lots of teething problems, not least the ability to cope with epidemics such as Ebola and AIDS, as well as depressingly low funding levels. But there have also been some achievements, including improvements in the supply of drugs and vaccines, and emergency response teams have been set up across the region. But a lot more clearly still needs to be done. Well, a new Director General has been appointed to scale up health operations at WAHO. He is Dr. Stanley Okolo, who for many years led parts of the National Health Service in the UK, and he joins me now in the studio. Thank you very much indeed for joining us, Stanley, and congratulations.
Thank you very much, Charles.
So the West African Health Organization, WAHO, marking 31 years since its inception. Tell us briefly what the organization has achieved in that time, because looking in from outside, what we see is a sub-region that's still ravaged by disease and poverty and is almost entirely dependent on handouts and health assistance in terms of things like funding and technology from the West. So in that sense, I mean, it hasn't really achieved much, has it?
Obviously, if you look at it in that light, in terms of where we are today, you have to think about where we were when it was created. 31 years ago, what we had were countries working on their own, countries trying to promote health and look at their health epidemics on their own. And when we're talking about these 15 countries, 340 million people, but you have countries like Nigeria, which has 180 million people, where we are, and you have other countries that have about 1.4 million people. Now, you ask yourself, how could countries like Liberia and Sierra Leone, who unfortunately were, and Guinea, who unfortunately were ravaged by Ebola, how they could have coped on their own if it wasn't for the regional structure that came together to support some of the weaker ones. So actually, WAHO has achieved a lot. Now, WAHO has not only achieved strengthening some of those networks in terms of how we respond to epidemics, and we have still low-level epidemics that bubble up from time to time, Lassa fever, yellow fever, but it has also achieved the fact that the strengthening has resulted in our surveillance in terms of being able to know when these things arise and then being able to be fleet of feet in trying to cope with that. So that's one aspect in terms of. Think about the fact that some of the things regarding health, human capacity in terms of professionals in healthcare. If you trained in Nigeria before WAHO was created, you might find it difficult to work in the Gambia because, you know, things like qualifications were not recognized. WAHO has harmonized this so that you can have free access and free movement of professionals across the region with their training, which has now been harmonized.
Well, let's talk about those professionals, because most of them are leaving West Africa and traveling to Europe and other parts of the world.
Yeah, that's true. But of course, that is also partly because of the issues that to do with some of them in terms of their personal development, some of them because they may not have had the things with tools with which to work. So let me tell you what we are trying to do, because I think it's important to think about where we're going. WAHO already does have the background and the footing to move on and develop something. So for example, I was going to talk about the harmonization of medicines policies. The way we're coming is that I have articulated 5 major themes that I think we're going to focus on.
And that's what you want to do as the new Director General.
Absolutely.
Right.
And that has
so this is a new place you're going
well,
to
but
now.
that has also been approved by the Assembly of Health Ministers who met last month in the Gambia. And really, it's how do we bring what we are doing to scale it up for population impact, knowing that whichever of these 5 themes, which I will describe to your viewers at the moment, we are embarking on, we must look at capacity building so that we ensure that there is capacity, strengthening those networks I've talked about, because of course, as you know, every network, every chain is as strong as its weakest link, so we must support each other and ensuring that they're sustainable. So if we have to ensure sustainability, in terms of these themes, one of them will be maternal child.
Yes,
and
because the question I was going to
adolescent
ask you is that maternal and child health, for instance, still one of the worst in the world in terms of mortality. So clearly not much progress there.
Well, you have to know that we are coming from a place where we were in a position where it was every man to himself. The ECOWAS, which is the economic community, is moving from a community of states to a community of people. And so we are now in a position where we are all working together. So yes, and also whilst we're doing that, we have had epidemics that have come up and we'll focus on it. We are not going to leave the day job, but we will, in addition to being able to have surveillance and respond to epidemics, now start looking at those hard-hitting areas where people are dying. You've talked about maternal mortality. In Nigeria, for instance, about 58,000, start to die in childbirth. That is not acceptable. Childbirth should not be a death sentence. Then we have children that don't live up to 5. Then we have the issue of adolescents and drug use. But that's one. What of the issue of drugs, pharmaceuticals? Drugs in terms of manufacture, regional, in terms of quality, fake drugs is scourge, and we have to think about
Well, I mean, what you're saying there sounds like you've got a monumental challenge ahead of you. I mean, you're listing for us the things that you've got to cope with. I just wonder how you compare this to working at the NHS in the UK.
Well, you see, if I wasn't really keen and looking at how we can tackle this and knowing that the building blocks are there, I would have chickened out. Charles, you have to remember, your dreams have to be big. If your dreams are not big, if your dreams don't scare you, they're not big enough. There are dreams that I know we can achieve. What we are really asking for is, because this organization was set up by the governments, by the heads of governments and states, we're asking for that continued concerted political will.
And funding, of course. The
funding.
key thing is funding.
Yes, it is funding. But you know also that part of the thing that is driving this is that the governments themselves came together and set a bar of 15%, the Abuja Declaration, that they should all aim to get to 15%. Some have reached 8%, some have reached 9%, others are coming up, some have reached 10%. So I think we should be proud in West Africa of what the place we're going to. But I think now is the time to now scale it up, to try and make sure that we impact on those people who are dying, that we look at not only the fact of maternal, child, and adolescent health, the fact of pharmaceuticals, bring in some quality and centers of excellence. So why should we be spending $1.2 billion outside this region, going to India and places like that in terms of sanitary evacuation, as the French call it, or medical tourism?
Well, we're virtually out of time. How will you be marking this 31 years of the existence of WAHO?
We have actually already marked the Monday, which was the date that it was, the 9th of July, across all the countries. I sent my message to people, trying to tell them what we have achieved, but also telling them the challenges ahead. And what we're now doing in Nigeria, we have a research day, which is again part of this program of taking evidence into practice, so that we brought policymakers and researchers together. Then we also have other information that I now please advocate and ask that the media should try as much as possible and sensitize our people towards some of those things that we're hoping to do.
Dr. Stanley Okolo, Director General, West African Health Organization, thank you very much indeed.
Thank you, Charles. Thank you.